113th Military Hospital, New South Wales. It is the largest hospital in the Southern Hemisphere. When war began, this was the site of the home of a pioneer Sydney family. Today it can house over 2,000 disabled servicemen. Built of reinforced steel and concrete according to the most modern principles of architectural design, the main buildings are connected by bomb-proof tunnels. The walls are painted in soft, restful shades, and more than 1,000 beds are fitted with pillow earphones. An operating theatre fitted with the finest equipment that medical science requires. An operations in progress, an operation of the kind which, through plastic surgery and other marvels, has sent into the world well again men who had been terribly shattered by wounds. At 113th Military Hospital and other service hospitals are being performed day after day miracles of repair. It's more than a hospital. It's a community of healing, complete from neurological clinics to library for patients. Everywhere is the most modern of equipment. This is the laundry, to the average housewife a rosy dream. Here, voluntary aides are ironing sheets with the aid of the electric ironing machine. The kitchen, better equipped than that of the newest of the luxury hotels, and producing meals which are miraculous to men who've endured the hardships of the jungle.
The Army's handover of Concord Hospital to the Repatriation Commission was completed in December 1948. From that time onwards, Concord Hospital has continued to grow, reinventing itself as a general hospital, refurbishing and rebuilding, adding new specialist units, and all the time enhancing its reputation for giving outstanding and dedicated service to its patients. From an army hospital to a repatriation hospital, becoming a major suburban medical centre and developing into a teaching hospital and research complex now recognised internationally. Of course, its foundation in the dark days of World War II has not been forgotten. The memorial window for the hospital ship Centaur will always remind us of that, and the work of Red Cross volunteers will always be acknowledged. Proof again that Concord Repatriation General Hospital is a community hospital, a vital resource in the great city of Sydney. Concord's community spirit has always been its greatest strength and its people its greatest asset. For 93-year-old volunteer Peggy Dickinson, it's a place to call home. Concord has always served its people well, from its surrounding suburbs and across the state and the nation. Its aged care and rehabilitation centre features 2 acute care wards, 2 rehabilitation wards, a day hospital and an outpatients clinic. While the Bernie Banton Centre, named after the late mesothelioma crusader, houses the Asbestos Diseases Research Institute, a world-leading centre focusing on improved treatment, prevention and early diagnosis of asbestos-related disease. It shares the campus with another world-leading research centre, the ANZAC Research Institute, which in its first 20 years has won an international reputation for groundbreaking excellence in research. And next door, the Concord Centre for Mental Health is one of the biggest of its kind in New South Wales, providing patients with access to the very best clinicians and services available. The development of Concord Hospital over these past 75 years has not only fulfilled the vision of Thomas Walker and his daughter Dame Edith Walker, but has far outperformed anything they could have imagined. Dame Edith bequeathed the land, including the spectacular Uralla estate, to Royal Prince Alfred Hospital in 1938 for health and recreation purposes. Concord's burn service is known around the nation and South Pacific for its outstanding care of those who have suffered some of life's most horrific injuries, including those from the Bali bombings. And today, surgery is carried out in fully integrated digital operating rooms dedicated to endoscopic and minimally invasive surgery. And a major teaching hospital would not be complete without a purpose-built, state-of-the-art medical education centre to teach the clinicians of tomorrow. The $12 million facility has a 140-seat auditorium, multiple meeting rooms, and the ability to live stream lectures and surgeries from around the world at the flick of a switch. It boasts the most technologically advanced skills laboratories, 2 of which contain mock wards, a cardiac resus lab, an advanced anatomy room with the latest electronic anatomy table, a wet laboratory, and a pathology museum. Concord has always been good at adapting to the needs of its community, and now boasts a hospital in the home service where some patients can be treated at home or in a clinic on site. This service, partnered with the Sydney District Nursing Team, helps get patients back to their normal lives sooner. And caring for the community goes beyond treating illness. At Concord, the focus is also on wellness. The first of its kind in Australia, the Sydney Survivorship Centre gives cancer survivors access to a multidisciplinary team of professionals to help make that journey back to their normal lives easier, physically, emotionally and mentally. Patients are at the centre of every decision made at Concord, which is why its innovative palliative care unit has already won hearts. The 20-bed unit is a tranquil home away from home, giving those facing death dignity through physical, emotional and spiritual support. Also inspiring a new level of hospital pride is Concord's state-of-the-art hybrid operating theatre with imaging facilities. Clinicians can perform minimally invasive surgery using 4-dimensional cameras, ensuring patients receive care equal to the best in the world. That commitment to technology has always been at the core of Concord's progress. It was the first hospital in Sydney to introduce a high-field 3 Tesla MRI scanner, which has since been upgraded to the latest 3 Tesla Siemens Skyra magnetic resonance imaging scanner. Concord Hospital was also the first in the state to implement the electronic medication management system, eMeds, to improve medication safety from supply through to prescribing and administration. This initiative was awarded the Minister's top award for innovation at the New South Wales Health Awards. And the future is looking even more dynamic, with the New South Wales Government pledging $150 million towards the first stage of a new centre supporting geriatric medicine, rehabilitation and veterans' health. To be named in honour of former RSL President and long-time friend of Concord Hospital, Rusty Priest, it will be a centre of excellence treating the physical and mental health needs of a new wave of veterans and their families.